and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schupp, physical therapist.
Brad Einig, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
Both sporting our pink ties here today, Brad.
You bet.
They might be a little bit outdated, but they're,
Yeah,
they're appropriate.
Yeah, they're pink.
Breast Cancer Awareness Month is in October, and we're going to go ahead and show you these exercises to perform after you've had breast cancer and a mastectomy. This is not for reconstruction. This is just for after a mastectomy.
Sure.
And but before we do that, we do want to mention a foundation that we're fond of.
Sure.
The Pink Lotus Foundation. Again, I'll put their logo up here and their website down here.
Yep.
This foundation provides free services. I guess they provide funds so that women who are uninsured or underinsured or just can't come up with the money,
Right.
they're able to get free screenings and treatment and diagnosis and support
Right.
for breast cancer.
Sure. It's a good idea.
Yeah.
It's very
So,
helpful.
yeah, if you find it in your heart, go ahead and click on the link. I was trying to say both at the same time. Click on the link.
Yeah, that's a speech thing. Bob.
Yeah, and maybe contribute a few bucks. So.
Sure.
All right, let's start with the exercises.
Okay.
Brad. First one is diaphragmatic breathing, and that's important for two reasons, Brad. One, you're going to help with any possible swelling that you're going to get in the arm
Right.
afterwards because the lymph nodes are gone. And it's going to also help you just relax.
Right.
So,
Yep. And get some oxygen in your system and relax.
a lot of people have trouble understanding. You want me to do it?
Sure. Yeah.
A lot of people have trouble understanding why this helps with lymphedema. When you get swelling in your arm, the swelling doesn't go out your fingertips to go away. It has to go back into your body, into the
Right.
core to get absorbed
Right.
into your
Yep.
body. And the diaphragmatic breathing helps that.
Right. Go ahead. And so the swelling here is not like swelling if you sprain your ankle. This is fluid buildup.
Right.
And it's a little bit different system. Yeah.
Yeah, lymphedema.
Okay, so you're going to lay flat on your back.
So most people, when they take a deep breath, they think they're sucking their stomach in. But
Right.
actually what we want you to do here is actually to push your belly button up
Mm-hmm.
towards the ceiling when you breathe in. So I'm going to breathe in.
Which is completely different from what society wants us to do. We usually breathe to look, like we got a flat
Right.
stomach.
Can you see my stomach moving,
Yeah,
Brad?
right here. Come on, Bob, push it out a little bit. Let them see it. And the pursed lip breathing, you can see where you bring your lips together and tighten them up a little bit. So when the air comes out, there's some resistance.
Exactly. And when I'm breathing in through the nose, out through the mouth,
Right.
and the pursed lip, like Brad said.
Right. And then you're just relaxing everything, right, Bob?
Yep. And what's nice about this, you can do this seated too.
Sure.
And we'd like to see that you're doing this throughout the day. 3 to 5 times a day, I'd like to see you
And
doing
how
that.
long would you lay there and do this?
I'd like to at least 10 repetitions.
Okay.
So,
Okay.
all right, let's go to the next. Shoulder rolls. Brad, you
Sure.
want to show that?
So in shoulder rolls, we're going to go up and back and squeeze them back behind you. So we're thinking about going out with a good posture.
Yep.
Think of it that way. If you look at it from the side, you can see how I bring my shoulders back and shoulder blades together. Okay, and we're
And
about
besides, and it's getting some movement for the surgical site, but it's also helping with lymphedema.
sure. Yeah.
Again, 10 times. We're going to do all these 10 times so
Okay,
people
good.
remember. All 10 times, every one of them you can do 3 to 5 times a day.
Yep.
Okay, number 3, shoulder abduction. You just want to stand and show that one,
Sure.
Brad? You're just going to start trying to get some movement with the shoulder.
And you're going to go up if there's some tightness from the area that's been worked. You can stretch it, but you're not going to go into sharp pain.
Yeah, exactly, Brad. Good point. No, if you feel pulling or stretching, I really want you to stop.
Right.
Yep.
Yep.
You can work into it. You bump up against it, but then you stop after.
Right.
after
Yeah.
that,
So you don't want to rip things apart. It's gently stretching it over days.
Okay. How about shoulder squeezes, Brad? Do you want to flip around and
Sure.
show that on you?
Okay.
So he's going to squeeze his shoulder blades together. There's different ways people do this. Sometimes people put their arms up like this. Yep.
Yep. So we're not going up like
Yeah.
this. It's down.
Good point.
Down.
Don't be bringing the shoulders up. You're squeezing the shoulder blades together.
Sure.
10 times. The next one is what we call the chicken dance. I guess this is when
Yeah.
you're at the weddings in the Midwest. You're doing.
Maybe they do it all over the world. We don't know, but
So yeah. Da, 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 da.
yeah. So you're just working that
Yeah.
motion.
And again, this helps with the lymphedema, and,
Right.
and that's the main purpose of that one.
Do it at a comfortable speed. You don't
Yeah.
have to, try to take off into the air with it. It's just a comfortable motion.
Next one, Brad, we can do together. Hands behind the neck, and you're going to go ahead and And you're starting to stretch the muscles of the chest here with this.
Yeah.
Again, same thing. We're not going to go so aggressive that you're feeling, real stretching or real pulling. You're
Right.
starting to feel a little bit of it. 10 times. Good posture while you're doing
Right.
that. All right, and the last 4, we're going to go ahead and show up against the wall.
Sure.
Number 7, are we on? Or number 6?
7.
With the affected arm or both arms, you're going to go ahead and work on climbing up using your fingers to climb up like this. Can you see it here? Would that be better, huh?
Yeah, so you just use your fingers, and on the way down, I just like to kind of slide down and use the wall for some friction so it just doesn't
Sure.
come down fast.
You
but-
could do both at the same time
Sure.
if you want. Good posture. Same thing with you're going to work on abduction, which is going out to the side,
Sure.
and now you're going to work on going up. Again, up to that point where you get a little bit of a stretch. Okay. Now this next one's an aggressive one. This is probably later on down the line, Brad. And this is going to be a chest stretch. And you can do this in a doorway where you put your hands on both sides
Right.
and kind of lean in. Or you can go to a corner like this. I got my hands on both sides here and I'm going to lean in and start stretching.
Right, yeah, this is one you're going to want to take your time with and get a feel for it.
Yeah,
You
I don't want
can-
you pulling any stitches or...
You can vary it by the
Oh yeah, right. You can go different heights, right? Good point, Brad.
The lower your hands are, it's less aggressive, and as you raise your hands up, it becomes more aggressive. And so start out low and go up as
The final
tolerated.
one is you're going to want to go ahead and work on, again, 10 repetitions. You're going to go ahead and start working on internal rotation, working your arm up the back. So the one that's least affected, you're going to go ahead and use that to go ahead and pull up.
And this one, you may feel some nice stretch right up in here, but don't let it get sharp.
Right.
If you only can go up, even if you can only get up to the belt line, that's fine.
Yeah.
Take your time with it, give it.
And you can work both sides.
Yeah.
But Brad just made an excellent point. I don't want any sharpness either. I mean,
Sharp pain?
Sharp pain.
Right.
So go ahead and give those a try. And we always appreciate your feedback. And please subscribe if you haven't already.
You bet. Thank you.